Hello everyone. Today we will discuss the nerve supply of the posterior leg, basically the tibial nerve. The tibial nerve, as a component of the sciatic nerve, it gets separated from the common peroneal nerve at the popliteal fossa level. Then it extends from the popliteal fossa to the middle malleoli in the posterior aspect of the leg. In the proximal aspect of the leg, it is actually covered by the gastrocnemius and the soleus muscle. They are basically superficial to this nerve, gastrocnemius and soleus. And when if we remove this gastrocnemius and soleus, we will see that deep to this tibial nerve, there are three muscles. Tibialis posterior, flexor hallucis longus, one is flexor digitorum longus. This is in the proximal aspect of the leg. In the distal aspect of the leg, it actually runs in the cleft between the flexor digitorum longus and the flexor hallucis longus. And throughout the course in the posterior aspect of the leg, this nerve accompanied by the popliteal vessels, which are renamed as the posterior tibial artery and vein in the leg. These vessels are actually located on the medial aspect. Proximally, proximally, it is actually superficial to the tibialis posterior, and in the distal aspect, this vessel is superficial to the flexor digitorum longus, which we can see easily over here. This is the flexor digitorum longus. Now this nerve will enter into the foot. It will run deep to the flexor retinaculum. The flexor retinaculum, it is a bridge between the medial malleoli and the calcaneum. Other structures are also there which pass below this retinaculum. This structure can be remembered as a mnemonic: tiny dogs are not hunter. Tiny means tibialis posterior, dogs means flexor digitorum longus, R artery and vein, knot is the nerve, and hunter is the FHL. We can see here from the anterior to posterior, tibialis posterior, then comes the flexor digitorum longus, then comes the artery, basically posterior tibial artery, then comes the nerve, tibial nerve, and in the last, you can see this curved tendon. It is the flexor hallucis longus tendons. Now, within the retinaculum, or just proximal to retinaculum, tibial nerve bifurcate into the medial and lateral plantar nerve, plus it also gives a branch, medial calcaneal nerve. These three are designated over here. This medial calcaneal nerve, it is a sensory branch to the half of the heel, marked over here. Now let's look at the foot and let's learn about the medial plantar nerve and the lateral plantar nerve. Medial plantar nerve, it travels in the medial plantar region. It supplies the 3.5 digits of the foot, muscular supply, motor supply to the 3.5 digits of the foot. Now it actually travels between the two muscles, which we can see over here. This is the medial plantar nerve. It is running between the abductor hallucis and flexor digitorum brevis. Medial plantar nerve, it also gives a sensory branch to the sole of the foot, which originate just after the nerve enters the foot. This is the sensory supply to the medial plantar area. Next, we will look at the lateral plantar nerve. Now, the lateral plantar nerve, it travels deep to the flexor digitorum brevis muscle. This muscle marked over here is the flexor digitorum brevis muscle. If we remove this muscle, we can easily see the pathway of this lateral plantar nerve. Now, see, after reaching lateral aspect, it travels between the two muscles, the muscle quadratus plantae and the abductor digiti minimi pedis muscle over the lateral aspect. Lateral plantar nerve, it is analogous to the ulnar nerve because it has two branches. One is superficial, one is motor, deep branch. Superficial is the sensory one. The deep one actually supplies the intrinsic foot musculature, and that intrinsic foot musculature actually includes Over the dorsal interossei to second to fourth lumbricals and quadratus plantae, abductor digiti minimi. These are the muscles which are actually supplied by the lateral plantar nerve. Now we will look at the sensory supply of the foot, plantar aspect of the foot. Now, medial aspect of the heel is supplied by the medial calcaneum branch. The lateral aspect of the heel and the lateral border of the foot is supplied by the sural nerve. And now the medial plantar area is supplied by the medial plantar sensory branch, and this remaining portion is supplied by the lateral plantar sensory branch. That's it. Thank you.